This is LiveWell Talk on Reigniting the Spirit of Caring. I'm Dr. Dustin Arnold, Chief Medical Officer at UnityPoint Health, St. Luke's Hospital. A career in healthcare, while extremely rewarding, can also be stressful at times. At UnityPoint Health, Cedar Rapids, healthcare workers are encouraged to take care of themselves as they continue to provide the best care for others. One of the ways our team members can do this is through our Reigniting the Spirit of Caring retreats. Joining me today to share more about these retreats, Kallie Gutierrez, nurse manager of St. Luke's operating room and one of the leaders of the Spirit of Caring retreats, as well as Sharron Sturgeon, behavioral health nurse at St. Luke's, who attended one of the recent retreats and will share about her experience. Kallie, Sharron, welcome.
Thank you.
First question: Why did your spirit become no longer ignited? I mean, if it's reigniting, we're implying that it was ignited and then it went out. Kallie, what can you tell us what happened?
I think for me personally, the pandemic was a lot for healthcare workers in general, and there were a lot of changes, a lot of turmoil that came with that.
Yeah.
It was good to just be reminded of why I got into healthcare in the first place.
Yeah. I like to talk about, you know what you do, you know how you do it. And I think the people that understand why they do it, whether it's healthcare or finance or whatever, parenting, once you figure out your why, life is so rewarding. How about you, Sharron? How did you get involved in this?
So my lit had not been suffocated. I didn't need the reigniting, right? And my story is a little unique. Nursing was my second career. So I had been a nurse for about a year. And felt like I finally had my feet underneath me. And then I came across the description of it, and I was curious. I was curious how people were feeling when they had been a nurse for a long time, and what kind of things they needed as support. And I am driven by supporting others, and so I wanted to get into it to kind of see what I could do to support my coworkers and my patients. And then I found that I actually needed it as well. And so I got quite a lot out of it.
Well, and not making light of the reigniting and the cycle. You know, Pepsi just doesn't have a Super Bowl commercial, right? They have to constantly advertise. You don't go to church just once and go, yep, all right, I got it. You know, and right? I mean,
That's right, yeah.
You know, you have to have that continual relationship with whatever transcendence that might be in your life. And that's kind of what I think this represents. It represents the obvious, right? This isn't something shocking that you need to do that. It's something you need to do. Just like you don't put gas in your car once. You have to fill it up.
Absolutely.
What's your been experience with it, Kallie, as far as how you've seen other people react to it? Because I can imagine myself thinking at one point in my life, this is silly. Why am I doing this? And so I'm sure you get that, right?
Absolutely.
So walk us through how do people react to the program itself?
Well, I think there's definitely some of that, some skepticism sometimes, or people, we ask on the first day, like, what have you heard about this, or what are you expecting? And we inevitably get someone that says, well, I heard we're going to talk about our feelings and we're going to cry. But that's not really what it is, and it's cool to see the evolution over the 3 days of people coming in kind of nervous, not really engaging with the group, and then just the connections that form, the light bulbs that come on for people, and it really does fill their bucket. And I think people walk away a different person sometimes, and it's amazing to see that happen.
Yeah, that's always when that happens, when change, and you become. It's some people it's a lot easier to see that in their life and the reflection, and others it's very difficult. And I imagine this reaches out to everyone. What is this mandatory, or is it optional?
No, it's optional, encouraged. Because I think everyone can get something out of it, but no, we do not mandate it.
Do we ever have scenarios with our team members where maybe their manager or coworker says, you might want to look into this, but we're worried about you. I think one of the things about burnout is that I've simplified it down to say, for healthcare, learn how to gracefully say no. Learn how to do that gracefully, and also, you're not alone. Mm-hmm. Reach out to other people, because there are other people who feel the same way you feel. Mm-hmm. I think if we could do those two things, it would help from a burnout standpoint.
Yeah.
So is there other scenarios where there are scenarios where associates might be referred there by, or just encouraged? I don't know if I'm clumsy with my adverbs, but
yeah, I think this is one resource of many for our healthcare workers. Another way that people come to us is just through word of mouth. Their peers come and have a really good experience with it, and just as you're saying, either people's leaders or their friends will say, hey, I did this and got something out of it. I think you could benefit from it too. And then people come check it out and have a similar experience. So,
Sharron, and you've attended one of recent? Or?
So it was almost a year before I made my switch to behavioral health. So it was January of 2023 that I went, and the perspective that came with it was amazing. Just I realized just how much I'd been trying to live up to. Look at me, I'm really good at what I do. And being able to hear people from every different walk of the UnityPoint family, being able to say, I've been in this 30 years and I'm so tired, versus I've been doing this a few years and here's some of the things I struggle with, being able to say, I am not alone. And
yeah, that's
and
so true.
Even if there's nothing exactly that I identify with the other people, knowing that you're in a space where people are saying, yeah, this is really hard for me.
Yeah.
And I don't want to let down my manager. I don't want to let down my peers. But I could really use some perspective on this. Made such a difference for me.
Yeah. So. We're healthcare, we all know this. We're not very good to each other as far as, we tell each other to take care of yourself. But, unless you're dead, you need to come to work, right? Mm-hmm. Because there's only so many roles, right? Mm-hmm. And if you don't hear, somebody's got the roles you were going to do don't go away. Mm-hmm. Somebody has to pick them up, and so you don't want to let down your team members. But sometimes we just don't do a very good job of that with each other.
No,
we have tremendous guilt, and I don't have a great solution for that other than realizing it's present and don't feel guilty about it. If you need to, your help with your own wellness.
Yeah.
Can't take care of people if you're not well.
And that's exactly right. So knowing what things, being able to step out of the role on the hospital unit and doing the things I needed to do, being able to be around people that I knew had some connection with, some understanding of what I might have been going through on a med-surg unit, and being able to say, wow, that is a really hard thing for me. Let me figure out a way to do that. Not having that time, you're in survival mode, and all you're doing is, as caregivers, we want to give care. But if we're not fulfilling and refilling our buckets, we can't support our team members. And so when somebody comes up and says to you, I'm worried about you, I think you would really benefit from this. It's really hard for some people to hear that, because all of our being is giving that caring, and for somebody to say, yeah.
And I'm going to ask the obvious, because listeners that are team members may or may not know the answer to this, but I know they're thinking it is, do you still get paid for that day? I mean, is it like a regular day? So we say, this is an investment. Because I think that's important.
100%.
It's one thing to say, hey, this is important, but you have to do it on your own time. But for us to say, hey, this is important, and we're going to invest in you, I think that says a lot about the organization we work for.
Oh, my goodness. Yeah.
Are we the only affiliate with this? And how did it start?
So, Reigniting the Spirit of Caring is a retreat that was designed by a company out of Minnesota. It's called Creative Healthcare Management.
Okay.
And we actually had this program here several years ago. Creative Healthcare Management would facilitate it at that time. And following the pandemic, considering bringing it back again, Creative Healthcare Management actually came in and invited us to be facilitators this time. So we're all team members here at St. Luke's, and we're getting to connect with people that we wouldn't normally connect with. And it was brought in by the foundation, and they are fully funding the program. They funded people's hours when they would come the first year, and so yes, it's 100% paid for, encouraged by
full
leaders.
Disclosure, well, my wife works for the foundation, but an opportunity for listeners to also employee giving back, because this is an investment back in the organization when you do give that. So we had it prior to the pandemic, and then it was it had gone away, and then with the pandemic, okay. Now you and I've had these personal conversations, and I've said it. I think there's burnout where you do not have the satisfaction from what you're doing before. Then there's also pandemic fatigue, I think, and I think they're two separate things. They're probably treated the same, similar symptoms, but I think there was people that they weren't burned out. They loved medicine still. It's just what the pandemic brought was just fatiguing over time. Yeah. It's not like it was a snowstorm that we had to all rally for, or even a flood that we rallied for in 2008 for 3 months while Mercy was closed. But it went on and on and on, and still influences day-to-day operations. But it certainly has had its effect, both positively. It made people stronger, right? But also, I think we normally have about 12 to 15 physician retirements every year. And I think in year 2 of the pandemic, or going into year 3, it went up to like almost 40 in that year. Wow. So there's a lot of doctors who just said, look, I could still do this, but I'm just going to retire because I don't, so which good for them. I mean, that's, if you get to that point in your career, you should do that. I think we've illustrated the need for it and how it's paid for, and et cetera. And we'll also bring up registration. But I think we need to cover what actually happens. What happens at these retreats? You said it's 3 days. It's out at Prairie Woods, correct? Still? Yeah. I used to cut through there, by the way, when it was an old abandoned farm, to go to Nixon Elementary back in the day. But so it's out there. But kind of take me through what happens.
Yeah, absolutely. It is out at Prairie Woods. It's a 3-day retreat. Beautiful center out there, so we're really appreciative of their partnership on that. But and we think it's important to take people off-site, really remove them from the work environment and the stresses associated
It's too tempting
with
to answer the phone or return a page,
exactly.
etc. Check email.
Exactly. So the retreat is focused on caring for yourself, caring for your colleagues, caring for your patients and families, and then transformational leadership. So in the beginning, we really focus on just filling people's toolbox. We talk about mindfulness and meditation and communication techniques, self-compassion. And then the next day we bring in patients and their families. So people who have been in our care within our health system, and they get the opportunity to talk about what that was like. It gives the participants time to ask questions and be curious about what really makes people feel cared for, what matters most to them, and typically they find that it's the little things that really mattered the most. We give a lot of time for reflection and self-inquiry, and then on the final day we talk about transformational leadership. So how do I take everything that I've learned here and bring it back to my work environment and apply it there? The really cool thing about that is our, like I said, the foundation is very supportive. Our administration is supportive. HR, the hospital board, they are kind of threaded throughout the 3 days, and they're really involved in the final day where they're a part of those conversations. So people get the opportunity to share their ideas with our hospital administrators. But it gives a chance for people to be collaborative and talk about how we can care for ourselves better in the work environment, how we can provide better care for our patients. And like I said, the patients have a seat at the table, their families do, or our team members and hospital administration. So it's a cool experience.
Sharron, you mentioned you were on orthopedics when I first met you.
Yeah.
Took care of my aunt. I don't know if you remember that.
Yes,
Aunt Di.
I did.
I remember you taking care of her. But now you're in behavioral health.
Yeah.
Did you pick up some tools that help you be a better behavioral health nurse?
That is a really good question that you didn't prep me for. No, I'm just kidding. Yes. Yeah. Going to this retreat allowed me to step away from the purely medical side of nursing and be able to listen and listen even if there aren't words when a patient is struggling, or when a coworker is struggling, and be able to sense and think about what can I do to better support them. So I had never done meditation. I had never really engaged in mindfulness. At the time I thought I had. And then doing some of those activities, I was like, wow, there are things I haven't tapped into that I can then better bring my coworkers and my patients. And so I loved working orthopedics, but I found myself continually drawn to the patients who were struggling mentally with some of the changes that were going on in their body. And so when an opportunity came up to work in behavioral health, I thought that would be a really good next step.
Yeah, I'm really proud of the behavioral health services we provide here at St. Luke's. We are a role model institution for how we handle that. Well, we've talked, you went to this retreat and hopefully kind of learned your why. But why'd you choose healthcare? Sharron, let's start with you. This is your second career.
Yeah, I studied biology as an undergrad student, and then had the opportunity to study abroad. And when I lived in Europe, I was amazed with all the life that is out there and all the cultural differences, and decided that was the vein I wanted to pursue. Nursing had never been thrown out to me as an option. It had always been, let's go to medical school, and I wasn't drawn to medical school. So when I had the chance to study abroad, I was like, oh my God, there's so many amazing people with so many different lifestyles that I wanted to really understand better. And so I did that for almost 20 years, and it was amazing. I lived abroad, I lived in the States, and had all those different experiences, but things started to change in the world of education, and I still felt continually drawn to caring for people and to supporting them and to helping them along their path. So my undergrad degree in biology said, well, nursing can't be that hard. And nursing was the hardest thing I've ever done. And so that it brought me back into this. To be honest, I wanted to be able to come home here to Cedar Rapids. I was born at St. Luke's, and I wanted to be here for my family. And I knew that nursing was a kind of career that I could rely on for the rest of my life, but also still fulfill my connecting with people and helping them on whatever path that was. So that's what brought me to
That's a great story.
Working there.
Yeah.
Thanks.
Kallie, why did you choose healthcare? Was it because we didn't do background checks? Is that how you ended up here? We know.
Well, I did kind of fall into healthcare.
Did you really? I guess honestly, you and I talk all the time.
Mm-hmm.
Our roles overlap quite a bit, but I've never really heard your backstory. How did I know you're a veteran,
Mm-hmm.
and thank you for serving, but how did you become a nurse?
Yeah, I was actually majoring in anthropology, and joined the military, as you said, to help cover some student loan debt that I had incurred from that. And medic was the job that was available to me when I did that. And through my career in the military, ultimately I did come to love medicine, and I got my nursing degree through the Army. And the first time that I walked into an operating room, I knew that's what I wanted to do. We say that about OR nurses all the time. When you know, and I did. And what I love about it is I loved anatomy. I love being able to take something that is causing someone pain or ailing them in some way, and within a matter of hours we can correct that for them. And I love the teamwork aspect of it, working alongside the surgeon and anesthesia and the OR team to collaborate and make that patient's life better. So
That's a good why.
That's awesome.
yeah.
Well, Kallie and Sharron, thank you again for joining me and informing our listeners and other healthcare workers about reigniting the spirit of caring retreats. UnityPoint Health Cedar Rapids team members who are interested in attending a future retreat, you can find upcoming dates and registration links by searching Spirit in Cornerstone. But also, if patients or their families are interested, they can contact nursing services and we'll direct them to the primary stakeholders that handle scheduling patient and families to participate in these retreats. Valuable feedback.
Absolutely.
And that is 319-369-7190, 319-369-7190. Thanks for being here today.
Thank you.
My pleasure.
Thank you for listening to LiveWell Talk On. If you enjoyed this episode, don't forget to subscribe, and if you want to spread the word, please give us a 5-star review and tell your family, friends, neighbors, strangers about our podcast. We're available on Apple Podcasts, Spotify, Pandora, or wherever you get your podcast. Until next time, be well.